10 seconds, stand by. And 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Let's have a good show.
Thank you. I would like to call to order the July 6, 2020 Cabarrus County Board of Commissioners work session meeting. Welcome everyone. I hope everyone had a good 4th of July holiday, and it's good to be back together again. First up on our agenda is approval of the work session agenda, which you all have a copy before you. Do I hear a motion that we approve the work session agenda as presented?
I'll move for approval.
Second.
We have a motion from Commissioner Shue and a second from Commissioner Kiger. Is there any discussion? Hearing none, all in favor, please say aye.
Aye.
All opposed, no. That motion passes. Thank you. Next up are discussion items that do not require action today. And first is our innovation and technology report. And we are happy to have Todd Shanley bringing that to us today. Welcome, Todd.
Hey, thank you. I appreciate the chance to give you a presentation today. Let me share my desktop real quick. Last month, we covered a different book about communicating a crisis. This month, we're going to, the Employee Digital Book Club is going to talk about 4 essential keys to effective communication. So it's a 12-day communication challenge. They'll work through practice of communication skills to build trust, transparency, and accountability. So don't forget to download that book on Hoopla and to use your Hoopla credits, as I'm sure Emery is going to mention here in a moment. She's going to join us. I have some really great news to give you guys. Although the NACO was going online this year, we did go ahead and submit 4 projects that we had done with some of our department partners, and we received 4 achievement awards this year. So one for last year's summer reading program for 2019 that we worked on in-house with Emery and her staff, a performance review chatbot, so the PSR that we're redoing now with HR received recognition, the tax abstract reconciliation process that saved a lot of time and man hours down in for David Thrift and his team, and then the elections IT mobilization. And that's just the way that we took Cabarrus County's approach to elections and doing things just a little bit differently here at Cabarrus, all 29 of the IT staff to support elections on elections day. So congratulations to all those departments and my great team, who really does a fantastic job and deserves all the credit. Again, as Debbie always tries to do, is really tie these innovation initiatives to the commissioner's goals. And so what we'd like to talk about today is how we've been addressing some things with COVID, and how Byron and his team have used technology to address the pool reopening at Camp Spencer. So there's a slide here of how you can go ahead and do that online, but Byron, I saw that you were on. I didn't know if Joshua was able to make it, but I'll let you kind of jump in here and talk a little bit about that project and how that came about.
Thank you, Todd, and good evening, commissioners. Just wanted to bring this up, as Todd mentioned, that we were faced with a unique situation with COVID and the pool situation. We have normally 150 people capacity limit at our pool at Camp 10 Spencer Park, and we normally have very long lines waiting to get into the pool on a regular basis during our pool season. And so we wanted to try to figure out how to get ahead of this and still provide a service to the patrons while doing it safely. And so we went to the ITS department, and Joshua Kaufman and that team ended up coming up with a really great layout that Todd's showing you here a screen of actually turning the system from a first come first serve show up reservation system to an online reservation system with slots. So this way that people could know what the current number of people who are wanting to come into that space are, how many spaces are available, and then also just reducing the number of people that will possibly be waiting in line or possibly turned away because we have already reached capacity. So the COVID restrictions from DHHS actually reduced our capacity down to 42. So 150 down to 42 was a drastic hit. So we I think came up with a great plan to be able to provide 3-hour time slots for people to come in and enjoy the pool and be able to do so safely and still really hit the customer service piece of it, of not having to show up to a park expecting to be able to get in the pool, knowing ahead of time before they ever leave the house. So greatly appreciate the ITS department and our department of how they were able to put that together. And just another little side note of that, we also have our summer camp going on as well at the Cabarrus Arena and Event Center. So thank you to the Cabarrus Arena and Event Center for what they were able to do for us by providing the space since we've lost the barn. But ITS also helped our staff get up and running, and they're at the arena. So laptops hooked up to the printer system, everything that we need to run a successful summer camp. So they have really helped us out, and thank you so much.
Thanks, Byron. I think the goal of these are always to show the innovation that Cabarrus County is trying to deliver to improve on the citizen experience, and then to show that we as the government, we're still open. Even though COVID-19 is affecting us all, we're trying to keep some normalcy here for the residents of Cabarrus County. The next session, or next thing I'd like to cover that we've done a little bit differently this year, although we did write the in-house piece for 2019's Summer Reading Challenge. COVID-19 presented a whole other set of challenges, and this Beanstack application that Emery and her team have deployed this year to be able to track and do some different things with the summer reading program. Emery, are you on yet?
I am.
Great. Well, why don't you go ahead and tell the board and the citizens how you guys have delivered this summer reading this year.
Absolutely. So we, of course, summer reading is always our biggest event every year, and we normally have between 5,000 to 6,000 participants, which, in a time of pandemic isn't really something that's feasible. But of course, our mission is still to encourage literacy and education and learning as much as we possibly can. So we explored some options on how to do that digitally and found this awesome Beanstack app. So with this app, which you can also use it in a browser if you don't have a smartphone, but it does work with smartphones as well. You log your reading time by either scanning the book, or you can just type it in. And then we also have some fun activities and challenges that you can do from home. And that is for all ages. So yes, we definitely want to keep kids reading this summer, but adults, please feel free to participate as well. Our numbers right now are great. We've had it up for about 2 weeks now, and we have 1,285 users, which we are very excited about, and lots of older children and adults this year. And so far, as you can see, they've read over 236,000 minutes. So we knew participation would probably be a little different this year because it was so new, but our goal for the summer was to get the community to 500,000 minutes. So we are almost halfway there, and only 2 weeks in, so that's very exciting. We are also hoping to use this app. It is great for summer reading, but it's also a tool that we can continue to use after the summer's over. So I have a meeting with several of my staff tomorrow to talk about a new program we are hoping to start in the fall called 1,000 Books Before Kindergarten. And that is an early literacy initiative that will really help promote parents and children reading and learning together before the child even starts school. So we are looking forward to all the cool things we can do with Beanstack and keeping that going. In addition to Beanstack and our digital summer reading program this year, of course, we're also doing the curbside services while the facilities are closed. And that has just really taken off. I'm not sure what happened in the last week or so, but it seems like the other half of the county has discovered that we have it now, and it's been very busy, which is wonderful. Just, you know, so you kind of have an idea, we made 225 new cards in June. And there were over 14,000 holds placed in June. So every time I've looked out the window today, the whole parking lot has been full at the Concord Library doing curbside holds. So people are really, really enjoying that. And we are enjoying seeing everyone from a safe distance. And if anyone has trouble or questions about how they can place holds or take part in that service, they can call us or email us at any time. And one other thing that IT is helping us with right now that we are hoping will continue to serve the community while we are closed is parking lot Wi-Fi access. You know, usually the libraries are a great source for computer access and internet access if you don't have that available at home. And right now we cannot do that. So we know that we've left a big portion of library users out by moving everything digital. So to kind of try to bridge that gap a little bit, IT is helping us expand the wireless access out into the parking lot so people can sit in their cars, hopefully, and safely, you know, get schoolwork done, get job applications filled out, or whatever that they need to do, just communicating with their families with that Wi-Fi access. So we are really happy to be working on all these things and being able to provide those services.
Great. Thank you, Emery. I think that concludes this month's innovation report. I didn't know if the board had any other questions or comments around that.
Okay, anyone have questions for Todd or Emery or Byron?
This is Liz. Emery, I just want to tell you, I saw a shout out for you guys today on social media about how great it was that doing the holds on books and being able to have access. So good for y'all for working on that, and good for technology for making it work for you.
Thank you. Thank you. That's exactly what we want to hear.
Great. Any other questions or comments? Well, thank you very much, all of you. And it is certainly impressive the way our IT folks interface with all the other departments and make all these things happen. I think during this challenging period that we've experienced over the past few months, we have really seen how valuable those relationships that you guys had already formed prior to that, and it's really paid off in a big way for all the citizens of Cabarrus County. So thank you for everything you do all the time, including making these virtual meetings run so smoothly. I do think Commissioner Honeycutt was experiencing some difficulty with the screen share on that last presentation, so we might have to work on that a little bit. But thank you. And so our next item is the State of the County Health Report from the Cabarrus Health Alliance, and I know that Marcella Bean had, well, I see she has joined us. I thought she might still be tied up with another meeting, but welcome, Marcella, and we will turn the floor over to you.
Wonderful. Thank you all so much. Sorry that I'm late. I've gotten the opportunity this week to sit in on Concord PD Sergeant interviews. So we just got done with J1. So I'm glad that I could join you all for your work session. I believe that there should be, do I need to screen share myself, or Lauren had shared that it was in the packet possibly? Is there a way to share that?
And Lauren is with us. We'll let her speak up on that one.
Oh, wonderful. Great, so I'll go ahead and get started. So as you all know, each year I've had the opportunity to come in to present to you all at one of your commissioner meetings. So the State of County Health Report is a report that we submit to the state every year, and it gives an update on the identified priority areas for Cabarrus County. I'm coming a little bit later this year because of COVID, and then also I was on maternity leave towards the beginning of this year. So I wanted to make sure to still touch base with everyone about what the report says. So this first page here, as usual, kind of just gives an overview of what the State of the County Health Report does. And it also talks about the overall size and kind of makeup of Cabarrus County, including the municipalities. But really the fact of the matter is the 2019 and any of the State of the County Health Reports are an update to our community needs assessment. We have just concluded as of last week the 2020 community needs assessment, and I'll be putting out some information soon about the new identified priority needs. You can go to the next page, Lauren. And so this section here, it shows you the county population, so the breakdown demographically by age, by race and ethnicity, and then also by sex. Something a little bit different and a little more in depth looks at some different categories as well. Percentage of those who live in poverty, and then also educational attainment levels and unemployment rate. What I think is really interesting, if you'll remember, this is for 2019. And so I think what's hard right now is, you know, we're already halfway through 2020, and I would put money on it that most of these numbers will have shifted, especially when we're thinking about individuals in poverty, and then also our unemployment rate. At the time, it was significantly low, around 4% for unemployment, but I know we've already had thousands of claims with the unemployment office because of COVID. So I think things will look quite a bit different next year. Next page. The next several pages give you an update on each of the priority issues. So this is looking at the first one, which is substance misuse. We look at illicit drug use specifically. I know I shared last year that one of the data sets we used from the National Drug Use and Health Survey, or the National Survey on Drug Use and Health, specifically looked at illicit drug use. The problem became, and they changed their survey, that the term illicit drug use included marijuana, but in some states, because of the legalization of marijuana for recreational use, that is no longer considered in that category. So it kind of made it difficult to compare state to state with that question. But what we've decided to start tracking and really look at is going to be the Cabarrus Youth Substance Use Survey. This survey is administered in both school systems. And you can see we have data from 2015 all the way through 2019. The survey was not administered in 2018 and also will not have been administered in the springtime of 2020 because of COVID and school being released early. But you can see a downward trend there of reported substance use by youth in our county. And then if you look at opiate specific calls year over year, we also, I believe, had a slight decline there. I will tell you this weekend I got the report from EMS on the number of overdoses for the month of June, and it was at 43. So that is significantly higher than where we have been, where we've been mostly in our 20s. It's somewhat gone on a slow uptick. We've been asking participants of the syringe exchange program. We don't know if it's additional stressors for individuals, if it's a bad batch in very generic terms, about why we're seeing that increase. I am a little bit concerned that that could continue to happen, but we'll continue to monitor that closely. And I know you all obviously receive reports from EMS as well. The next section, it'll roll on to the next page actually as well. Yes.
This is Blake. Can I just ask a quick question before we leave this slide? Yes. The prescription medication question that has not been asked until 2019, is that a question of just if you're on prescription medication or if you've taken it without a prescription? In other words, you know, when you're not supposed to be taking it.
Correct. It's the second. So the question is, have you taken a prescription without a doctor's note or prescription? Okay. Yes.
Okay.
So oh, go ahead.
No, that's what I mean. I assume that's why this would show up, but that just wasn't clear. So okay, fantastic.
And we asked about different types of prescriptions as well, between stimulants like Adderall or Ritalin, or depressants or prescription painkillers, and even steroids. So we ask about different types of drugs on top of just prescription medications as its own category.
Okay, thank you.
Uh-huh.
So can I ask one quick question?
Yes, absolutely.
All the have gone down impressively, you know, through 2019. Any ideas as to what's driving that?
Around the opiate specific calls or the youth?
Hello. Yeah, like from 15 to.
Oh, the youth reported use?
Yeah.
So I think a couple of things. I think it has to do with, I think there's great education going on in the schools. I think there's also been a lot of community awareness, especially if we're looking in the category of tobacco and prescription medications. I do think the one thing about tobacco that could be a little bit skewed is a lot of times youth don't perceive tobacco use as also vaping products. So we did ask a question about vaping specifically, because they're saying, well, it doesn't have nicotine in it, so it's not a tobacco product, but we still know that there's the same chemicals and things like that for lung impact. I also, and we do try and sample, the school system does a great job of trying to survey one classroom at one grade level at every school. That's 6 through senior, so 6 through 12. But I think mostly it's community education and awareness. I think that really has been the driving force there to see those decline.
Thank you.
The bottom portion here and then rolling on to the next page is going to give you updates on interventions. So different strategies that have been implemented to address these topics. Lauren, if you'll go. Yeah, thank you. So we do have a large drug-free communities grant, which specifically looks at youth substance use prevention. And then the county also received the UNC School of Government opiate response program. And that looked at things like accessible treatment for all, assessing knowledge. And we actually included in our community needs survey this year a question about stigma. And I'm happy to share, when we looked at stigma as a question and asked people, you know, someone who uses I believe that someone who uses drugs, fill in the blank, we had negative response options and positive response options. So an example of a positive response option would be deserves the same level of care as someone with any other disease, should be treated like a human being, should have access to treatment. Negative response options were, you know, made a bad choice and deserve their consequence, is too weak to quit on their own. About 70% of respondents selected positive response options. And I think that's a really telling sign and a good sign that our community doesn't, you know, there's still stigma exists, but it's not a majority of the community. So I'm excited to share that. The bottom portion here gives you an update on where we're at with our action plan for substance use specifically. The only area that we're in progress is because it has to do with the State Stop Act. And obviously January 1st, 2020 has already taken place. So this one would be complete as well now. The next page looks at mental health. So again, it's going to give you some data on mental health updates. You do see an uptick in the number, this is related to ED admissions to Atrium Health Cabarrus. So you do see an uptick there in the number of admissions. I've shared before, but I think it's always important to highlight, among the geriatric population, Atrium Health Cabarrus is the geriatric, has the geriatric behavioral health unit for their entire system. So they are getting transports from other counties. These numbers here could include transports of other ages as well. It's not saying just Cabarrus County residents. So I think that's important to note. I will say when you look at our ED data for during COVID, people were not going to the emergency department. So there was a dip, especially around individuals experiencing suicidal thoughts, of those seeking emergency department treatment, but access to care continues to be the biggest issue for mental health and those seeking mental health services. The same thing here on the blue section and then onto the next page is the interventions and strategies that have been implemented over the last year. And then obviously at the top, it shows the action plan, what some of the goals were, which a few we're fortunate lie within our sheriff's department around those being screened at bookend for mental health and substance use disorder. The last section here looks at childhood obesity, and we actually had, it shows here, and this data is from Atrium Health Cabarrus, is their ED or their electronic medical record system. We did see that it did get slightly worse in 2018. I am happy to share that in 2019, it dropped down to 31% for overall obese and overweight children in Cabarrus County. The biggest shortfall for me when it comes to childhood obesity and addressing in our community, the schools are doing great work. Our Parks and Rec folks are doing great work. Everyone, after school programs, everyone's trying to address it from every angle. I think where we lack potentially on impact is education to parents and the role that parents play. We had a question in the needs survey this year that asked about eating 5 fruits and vegetables a day, and lack of time and cost were the top answers as why people did not eat 5 fruits and vegetables a day. And I think if that's what we're hearing from parents, we can go ahead and know that that's also happening among young children. And I think to address obesity, we really have to put out better education to parents about the role that they play, and that oftentimes it's not quote unquote just baby fat, that there are concerns of children being obese at a young age. On the next page, it's going to give you the same kind of overall structure and update on interventions. So looking at the 5210 day of play, hopefully you are all, it's not listed here, but in 2020, we've started the Walk Cabarrus program, really hoping to get adults as well as children engaged in physical activity. And the Cabarrus County Schools got a large grant that they had started implementing last school year around really this farm fork and future, this F3 concept of having school gardens that were growing produce that could then be taste tested in the cafeteria, because exposing young children to different fruits and vegetables is so important. Again, at the bottom here, you'll see where we're at with our action plan. This is the only item in our whole action plan that was incomplete, and it was to host 2 PPP Healthy Lifestyles programs. One has been hosted, but we have not been able to host a second one. And then obviously with COVID, that's kind of put a damper on it for the 2020 update as well. The last couple of pages, so the next one I believe is going to give us mortality and morbidity data. The one section that I'll note that has been added here is going to be the leading causes of death by age. I think it's an interesting way to look at the data and how cause of death changes by the age of the individual. I will point out again, as I have in years past, that Alzheimer's disease, the rate of Alzheimer's disease deaths is higher in Cabarrus County than the state and continues to climb. I think that's partially linked to our aging population as they become one of the largest populations over the next several years in the county, even larger than those 18 and younger. Most of the other areas we align with the state, but I do think that Alzheimer's disease continues to climb. If you look at that leading cause of death table, the column to the right is how they ranked for Cabarrus County, and the column for North Carolina, those numbers are how they rank for the state. So you can also have a quick reference to kind of how those leading causes of death we compare to where they fell at the state level. Suicide is on our top 10, and it was not included in the North Carolina top 10 causes of death. And then the last page, I believe, is going to go over emerging issues. So again, I've referenced the Alzheimer's rate of Alzheimer's death, but also Medicaid transformation. If you remember last year, we were supposed to be transferring everyone over for Medicaid plans, and that got put to a stop by the state in November of 2019, and that just potentially leaves a lot of people uninsured and at risk, and then obviously even more so now as individuals lose their job because of COVID-19 and their access to care. The bottom portion is new initiatives. I think the most important, well, there's a couple on here. One is the Cabarrus Hub, which I think is instrumental to cohabitating services for individuals that live in our community. But I'm also happy to share something called results-based accountability, and that is something the Cabarrus Health Alliance is working on so that we can have ongoing, better data that's available to the community and to you all as elected leaders at all times to review and see how we're doing with a specific area. Outside of just the needs assessment priorities, but infant mortality, how are we doing around our immunization rates for adolescents, what's our teen pregnancy rate, so that you all can see those things and really keep a pulse rather than me kind of coming around once a year, but really being able to look at it anytime. And so that's something that we're working on as an organization that we hope to roll out and have available to anyone in the public to go on and view our scorecards and see what we're doing to address needs as they're identified. That is all. The last page just talks about the importance of communication and how this message will be shared with community partners. But I am happy to answer any other questions that you all may have at this time.
Any questions for Marcella? Well, this I think is my second time hearing this report, and I think you did a tremendous job. The more that we can publicize all of the information that's contained in there, that's not a lot of pages for a tremendous amount of information. So you folks have done an excellent job of compressing that down to the really important points. So kudos to you and your folks that have worked on it. And certainly, in addition to that, the community needs assessment that you mentioned in your presentation that finished up last week is one of the most comprehensive looks, I think, at everything that goes on in Cabarrus County. It certainly hearing that additional report a little bit later on. So thank you very much. Anything else for Marcella before we move on? Thank you for joining us today.
All right, thank you. Y'all have a great rest of your day.
Great.
Thank you.
And you don't have to leave. You're welcome to stay through the whole thing. So.
Oh, am I?
But we'll leave that up to you.
All right, thank you.
Okay, we move now to discussion items for action. First up, from Active Living in Parks, we'll have Byron Hagler back to talk about fiscal year 21 matching incentive grant request.
Good afternoon, everybody. This is actually Megan Bumgarner. I'm the current chair of the Active Living Parks and Parks Commission. I will be making the presentation today instead of Byron, but he is on deck if anybody has any questions that I cannot answer. So I'm here to make the presentation about the matching incentive grants request for fiscal year 21. The incentive grant program encourages local nonprofit groups to provide adequate recreation facilities in Cabarrus County and their local communities. The grants provide up to 50% of the actual project cost, subject to approval by the commission. Up to date, the Matching Incentive Grants program has provided a total project cost here in Cabarrus County of over, this year, I think you guys have in your paperwork a small spreadsheet. We were budgeted $50,000 to allocate through the Matching Incentive Grant program as the Active Living and Parks Commission. We have 2 applications currently that are requesting funding, one for $14,000 and the other for $11,700. The first program asking for funding is the Concord Rotary Outdoor Multi-Purpose Area for the Concord Senior Center. They are requesting $14,000. As you all are aware, the Concord Senior Center currently has over 70 programs, classes, or events that they actually provide indoors at the Concord Senior Center currently. The demand for additional space is imperative to continue to meet the needs of the county. We are growing, our age is rising, and also the current trends, unfortunately, given COVID-19 and the fact that outdoor activities are now considered safer, especially for senior citizens. And also just to improve the overall quality of life for those that are served through the Concord Senior Center. The recreation area will provide opportunities, including but not limited to things like outdoor dances, a recreation area for senior games and Special Olympics events, exercise classes, and also included in this request is enhancing the overall aesthetics of the Concord Senior Center. The Concord Senior Center is actually not just for seniors, it's open to anyone in the public. So the ultimate goal is to make it as nice as possible to draw more and more members of the community in. This request for funding in this project is actually meant to enhance those services. The total request for the project is $75,000, or the total project cost is $75,438. So over $75,000, they are asking through the Matching Incentive Grant program that the county only fund $14,000 of that money. Just so you all know, the application was complete and correct, and this request is actually a level 1 highest priority request. The ALP Commission recommended that we fully fund the applicant's request for $14,000 in terms of this application. Any questions about that application so far? Okay, great. The next application was from the Harrisburg Community and Youth Association. This is actually a Field Lights group where they want to do a relamping project at the baseball and softball fields at Harrisburg Elementary. So the complete group relamp of Harrisburg Elementary baseball and softball field lights include replacing all lamps, lens cleaning, and proper alignment of all fixtures for all 4 fields at Harrisburg Elementary. The benefits of this service will provide the best lighting uniformity on all ball fields for players and spectators. Right now, the lights are producing a pink hue and actually dim green tints, which indicates that the lamps are at the end of their useful lamp light life. This actually causes significant safety and playability issues because when the kids look up, they're seeing spots. So it creates sort of a problem when a juvenile is out trying to catch a ball. The proposed group relamp will save money over the next several years by avoiding repeated labor and lift expenses for repair of pot lamp outages. So it's actually more cost effective for them to do everything at once to save in labor cost rather than fixing each individual lamp as it goes out in the upcoming future. The total project cost is $23,400. They are asking through the matching incentive grant program that the county fund $11,700. Again, it was a complete and correct application. They are a level 2, which means a moderate priority, and the ALP Commission recommended that we also fully fund their request of $11,000. Any requests specifically about the Harrisburg Youth Association? Okay, so just to update you all again, our fiscal year budget is $50,000. The funds requested so far that the Active Living and Parks Commission approved was $25,700, which means that our remaining fiscal year 21 funds is $24,300, and our second cycle of applications will be due October 9th of this year. You have a budget amendment included in your packet, and so we are respectfully requesting that you all fund those 2 applications at their full request based on the Active Living and Parks Commission recommendation from our June meeting. Any questions?
Any questions for Megan or Byron? Great. Well, it sounds like 2 wonderful projects. I mean, obviously, you can see that Cabarrus County taxpayers get a lot of bang for their buck through this program, and has really created a lot of positive elements in our community that everyone can enjoy. So thank you and the Active Living and Parks Commission for all of the work that you put in evaluating these applications and working with these folks to cause these things to happen. Thank you.
Thank you so much. Thank you. Y'all take care.
Okay, we move now to item 4.2, appointments to boards and committees. And you all have received a report with all of those various boards and the recommendations for appointments to them. Does anybody have any questions or comments at this time? If not, I will mention that that we have had an opening on the Centralina Economic Development District group over the past several months. This, if I remember correctly, is calls for a person from the business community. I think we've talked about it a couple of other times to come up with some names that we would recommend to that, but we have not know of names that you might recommend for people from the business community to serve on that Centralina Economic Development District group, and we will go ahead and submit those names and fill that vacancy. So hopefully we can maybe get that some of those names in and get that taken care of before our regular meeting in 2 weeks. So any comments or questions on the appointments to boards and committees? If not, we'll move to item 4.3, This is an item that we do need to take action on tonight, and that is the NACO, National Association of Counties, voting credentials for their 2020 annual business meeting. Originally was scheduled to be held in Orlando. Now will be a virtual meeting, so it will be really easy for any of us to attend. And so let's see, we've got I'm not sure, Lauren, do we have anything? We just need to assign one board member to be our designated voting delegate. Is that correct?
Yes, sir.
Okay, I heard her way back in the background.
Yes, that's correct.
Yeah. Okay, great. So would anybody like to volunteer or make a suggestion as to who would be our voting member for the NACO annual business meeting? Nobody jumping to the front. I'll be happy to do it if you would like for me to.
Steve, what's the date of that particular meeting?
If I'm not mistaken, it is August the it's July the 20th.
July 20. Yeah.
That's a Monday.
Yeah, so that is.
Is that the same day that our business meeting will be?
I believe perhaps it is. Let's see. Yes, that will be the same day as our regular meeting, which our meeting's at 6:30 on that day, and I think that will probably occur earlier in the day.
Yeah.
I don't mind doing it, and I certainly don't mind if somebody else wants to do it. Either anyway is fine with me.
Yeah, the meeting's at 2 o'clock.
2 o'clock.
The NACO meeting is at 2. Yeah.
I would like to nominate Commissioner Blake Kiger to be our voting delegate to the NACO business meeting. Do I hear a second?
I'll second that motion.
Okay. Is there any discussion? First of all, we need to make a motion to suspend the rules to take action on this today.
So moved. Second.
Okay, we have a motion from Commissioner Honeycutt, a second by Commissioner Kiger to suspend the rules. Any discussion? All in favor, please say aye.
Aye.
All opposed, no. That motion passes. And now we will revert back to my motion to appoint Commissioner Kiger, and I think Commissioner Shue seconded that.
Yeah, that's correct.
Yes. So is there any discussion on that motion? Okay, hearing none. All in favor, please say aye.
Aye.
All opposed, no. That motion passes. Congratulations, Commissioner Kiger, and thank you for your willingness to serve in that capacity. So we will move now to item 4.4, and that will be the designation of our voting delegate for the North Carolina Association of County Commissioners annual meeting, which originally was scheduled to be held in the great county of Cabarrus. We were going to host that statewide meeting this year. Due to the COVID situation, of course, that has been canceled and will also be a virtual meeting. And that will be their annual business session will be held on August the 6th. And so we need to designate a voting member for that meeting as well. We don't have the time restraints. We don't have to suspend the rules on this one. That can go on our consent agenda for our regular meeting if we have a name to fill in that slot. So do I hear a volunteer to be voting delegate for the North Carolina Association of County Commissioners annual meeting?
Mike, do you know what time that vote will take place? Because I got your email earlier today about the groundbreaking for the courthouse on the 6th. And then, we got that at 4:30. And then what time would the meeting be for the vote?
I do not, I'll find out. I think it's usually right after lunch.
I've done that in the past. Unless somebody else wants to do it, I don't mind volunteer for it because I've done it in the past and it's virtual, so it's no big deal.
Excellent. Do we have consensus for Commissioner Shue to be listed on our consent agenda as our voting delegate? Excellent. Thank you, sir. We will proceed in that way. So we move now to item 4.5, and this is the Central Area Plan Interlocal Agreement. I heard somebody talking back there, but I couldn't hear what they said. Okay. We'll move to item 4.5, and that's the Central Area Plan Interlocal Agreement Modifications. And we're glad to have Jonathan Marshall and Susie Morris to talk with us about that.
This is Jonathan. I'm going to take that one. The Central Area Plan is a jointly adopted land use plan with the City of Concord. As you probably recall, it includes an area where there are public utilities and continue to be extensions of those utilities, but it also includes an area where we restrict those public utilities along with the City of Concord. A couple of years ago, we've had some exceptions to that are permitted by the agreement. A couple of years ago, Mr. Cook and the legal staff of Concord put together an ad hoc modification, which is included with your agenda. And we have two properties that are both wanting to connect to public water. This was really intended to curtail large-scale growth in those areas. These two properties do not fall in that category. These are just individual parcels and homes that for a couple of different reasons need to connect to that water service. So the City of Concord has already approved the agreement, and now it's before you to do the same. One thing that is unique about this, it all also goes back to the settlement agreement of some lawsuits about the extension of water and sewer, which also included the water and sewer district of Cabarrus County, which is not the water and sewer authority. The district of Cabarrus County, you are the governing board for that. So what you're going to see on your agenda is that this is on the consent agenda or proposed unless you want it to be otherwise, but it's also included under the water and sewer district. You'll need to open the meeting for that during your regular meeting and approve this item if you so choose.
You'll have to remind us on that one since that appears on our agenda each and every month. And we've actually, in the past 8 years, I think, have not done that. So that'll be something different for us.
Well, Lauren Linker's already set it up, so it's on your agenda. So you'll see that when you go to adopt your agenda later, that there's actually, you will, for once, be opening the water and sewer district and taking an action.
Excellent. We need that experience. Any questions for Jonathan? Okay, thank you very much.
Mr. Chair,
Yes,
just to go backwards real quick, the NCACC meeting is from Commissioner Shue is the business meeting is at 11 o'clock on the 6th.
Great, thank you.
Okay, I'll make the note of that. Thank you.
All right.
Okay, next item, 4.6, Coronavirus Relief Fund accounting changes. And we're happy to have Rodney Harris to talk with us about those.
Good afternoon. This is another item that we are asking that we suspend the rules and take action today. Back in May, you'll recall that the board accepted the initial allocation of just under $3.8 million in coronavirus relief funding. Coming from the federal government through the state. At the time, we placed those funds in the general fund for the FY20 budget. And as you will not be surprised, guidance has recently changed, which now requires that funding to be placed in a special revenue fund. So we are asking the board to allow the finance director to make those changes as appropriate and as required. Additionally, the state has approved additional funding to come to Cabarrus County from the second phase of coronavirus relief funding. So that should be, I believe, about $4.2 million And so we're asking for action to be able to accept that next allocation from the state. And then finally, we need a motion to allow us to carry forward these funds from the FY20 budget to the FY21 budget. And so you'll see down below the series of motions that we're asking for to allow the finance director to make the necessary changes to put things in place.
Excellent. Thank you, sir. Questions for Rodney? I think this all sounds like things of a procedural nature that just keep us in compliance with the federal government and so forth. Would that be a correct assumption?
That is a good way to sum it up.
Great.
Rodney, let me get for clarification now. We've got the 3.8 and we've already banked that. Is that correct?
That is correct.
All right, now the additional money that you're talking about, is that additional over and above the 3.8 or is the 4 inclusive?
It's in addition to the 3.8 million. So originally the General Assembly legislation approved 300 million, but only 150 million was allocated at the time. The governor recently signed the bill allowing that other additional 150 to be released to the county. So it's in addition to.
Will it have the same restrictions as the original 3.8 did, or do we have more flexibility there?
It is the same restrictions, but they have also added a requirement that 25% be shared with the municipalities.
Okay,
so that is now a requirement.
Thanks for the clarification, Rodney.
Okay, any other questions for Rodney? Okay, hearing none at this time, I would entertain a motion to suspend the rules.
So moved.
Second.
Okay, we have a motion by Commissioner Kiger, a second by Commissioner Shue to suspend the rules. Is there discussion? Hearing none, all in favor, please say aye.
Aye.
All opposed, no. That motion passes. At this time, I would entertain a motion to amend the fiscal year 2019-2020 budget ordinance to create the Coronavirus Relief Special Revenue Fund and authorize the finance director to prepare the appropriate budget amendments consistent with the GASB requirements.
Move for approval.
Okay, we have a motion by Commissioner Honeycutt, a second by Commissioner Shue. Is there discussion? Hearing none, all in favor, please say aye.
Aye.
All opposed, no. That motion passes. And I would also entertain a motion to amend the fiscal year 2020-2021 budget ordinance to carry over any unspent CRF funds, accept the second round of CRF funding, and authorize the finance director to prepare the appropriate budget amendments consistent with GASB requirements.
Move for approval.
Okay, motion by Commissioner Shue, second by Commissioner Honeycutt. Is there any discussion? Okay, hearing none, all in favor, please say aye.
Aye.
All opposed, no. That motion passes. Thank you. We move now to item 4.7, which is requests for a budget adjustment for the new middle school. And I think Jonathan's going to lead us on that one.
I'm going to start the process on this one. As you can see, Brian Cohn and Tim Louder, Kelly Klutz are also here, and you may have questions for Rodney Harris about the budget for this. But of course, the new middle school is actually underway. They've actually started the site package on that. But as they've gone through their pricing, and this is a construction manager at risk project, so as they've gone through their pricing, we've gone from an original budget of 43 million. they're actually a fair amount over that in their initial pricing, but through a process of working with the contractor, the architect, as well as doing some value engineering, they have reduced that, but it is still, with the bids in for this phase of the project, the guaranteed maximum price is $44,772,000. So I'm gonna let Brian and Tim talk about how they reached this point, and maybe you may have questions for them about some things that were changed in this project as a result of going through these pricing exercises.
Yeah. Good evening. Thanks, Jonathan. As he alluded to, we've been working with Shellco since about January of this year on the pricing of this project, and in the formal request we provided to you, we tried to outline the pricing exercises we went through before arriving at the bid day, which was back the 1st of June. We essentially went through 4 different pricing exercises with Shellco when we started this process, and the first couple of pricing iterations, we went north of where our number was and weren't very happy with that. And so after each exercise, we began value engineering the project, trying to identify certain areas with Shellco and with the design team that we could possibly cut some costs and save money, but not jeopardize the programming that we have in place for the school. You can see in the request, outside of those first couple of exercises, we continued to go in the direction we needed to go, getting closer to our original budget that I think is worth saying was established, well over a year ago. So, not knowing what the market does and how it's going to react in our specific sector, we are taking our best guess of what we have out there. We've also reached out to Yates Kreitzberg and tried to provide some clarity to where we started with the square foot budget that we arrived at for the 43 million versus where we're at and where we landed. And Tim's got some information that he was going to share with you on that.
Yes, we started out with a $235 per square foot budget for a 185,000 square foot building. Through all of our programming for 1,200 students, the best we could get to was everything we could as efficiently as possible. We got to 193,590 some square feet, so we didn't quite get to our 185, so that's part of our square footage cost. The good news is we came below our budget of only $231 a square foot, so we were below our budget per square foot, but our square footage is a little higher. In comparison, we reached out to find out where we were, and the last bid we've had that was very similar to ours was a Fort Mill Middle School, and it was 161,000 square feet for 800 students. And it bid at like $40,227,000, a hard bid. And they had a square footage of 200 square foot per student. In our case, we're actually at 160 square foot per student, so we feel like we have a pretty darn efficient design. I actually went through several iterations of the contract, the architect, bringing that square footage back down and trying to make it very efficient as we possibly could. So with all the numbers in, we feel like for $231 a square foot, we have a pretty good budget. The square footage, like I say, is about 8,000 square feet more than we had anticipated having, but we do have full gym and auxiliary gym and an auditorium in the school, where Fort Mill did not even have an auditorium with theirs, so we feel pretty efficient about it.
Yep. I'll be happy to try and answer any questions you have about the process and what we did, if you have any.
Any questions for Brian or Tim?
I've got a quick one. So the VE items that are listed, it says considered. So I'm confused. Were those, did we accept those, or they're still out there and we're still considering?
No, we did accept those, Mr. Kiger, and there was a list of about 53 items actually. I just tried to hit some of the high points of some of the larger ones out there that we accepted.
Gotcha. So are the ball fields irrigated?
They are irrigated, yes, sir.
Okay, so sprigging should be fine. So okay, great. Yep. Thank you.
I think it's worth noting in this delivery method, the construction manager at risk, and I know Kyle could speak to this as well, but it's provided a lot of insight into the construction documents, the way things are drawn, how they're drawn, the means and methods of certain items on these projects that a lot of times don't go identified when you go into a hard bid project. And so it's been greatly beneficial to us in terms of being able to identify those prior to going into bidding the project.
Very good. Any additional questions for Brian or Tim? And maybe Rodney can tell us how we could potentially make this work in our budget.
Yeah, so the intended route to addressing this is, as you'll recall, we did our first draw program for the debt financing, and that covers the new middle school. When we did that, the line of credit was up to $130 million. And the total for these projects was about $127 million. So we have enough capacity in that $130 million to absorb this additional increase for the middle school without having to use fund balance or other sources. So that would be the proposed way to fund this.
Right. Thank you. Any questions for Rodney? Or any additional questions regarding this item at all? When we approve those lines of credit and we talk about that up to, I think there's always a little bit of nervousness that why would we want to approve more than what we think we're going to use or what has been estimated. And I think this is a good example of why that flexibility is beneficial to us. And I think, as Brian mentioned, when we plan these projects, we never know what the climate is going to be out there from a bid standpoint in the construction industry. So I think this is a good example of it. It works well for us. Any additional questions or comments? Okay, seeing none, we will move now to item 4.8. We are happy to have Bob Bushy with us from our Transportation Department to talk about the Cabarrus County Long-Range Transportation Plan.
Good afternoon, everybody. I am presenting to you the Cabarrus County Long-Range Transportation Final Plan. This has been a 2-year process, and the plan is a blueprint for the next 20 years, and it is laid out in 6 phases. This plan provides service recommendations for both Cabarrus County Transportation as well as the CK Rider, and includes possible future consolidation of systems and possible future light rail. We are asking that you adopt this plan, and I'll be happy to answer any questions.
Okay, questions for Mr. Bushy. This is a pretty massive plan. A lot of work has gone into that. So I'm sure he'll be glad to address any questions anyone might have. Okay. Yes, ma'am.
I was going to say I agree with you. It's a very comprehensive plan to take all that in. But yes, we definitely have a need for it.
Yeah. Okay. Any other comments? Thank you, Bob. We will move now to item 4.9, and this is for the fiscal year 21 urbanized area funding. And we will set the public hearing on that, and Bob Bushy will talk with us about that as well.
Yes, this is a 5307 FTA Large Urban Grant. We are applying for $262,000 to be used for preventative maintenance costs. There is a 20% local match of $52,400. And as you said, this grant does require a public hearing.
Okay, any questions for Bob about this item? We do have that public hearing on our regular agenda to be approved later. Okay, thank you. We move now to item 4.10. Purchase order request from EMS, and we have Jimmy Lentz and Associates.
Thank you for that. And that is correct. Captain Jonathan Malden is on here if we would have any questions for him as the fleet manager for the EMS vehicles. But we come before you tonight for the annual request to purchase new ambulances for a budgeted total, or the purchase total, and the amount that is budgeted includes graphics, which are done locally here in Concord, and tax, title, and tag. So the PO we're requesting for is not quite the amount. The purchase PO is not quite the amount that we budgeted for to include the tax, title, and tag and graphics, in which we do locally. But the $502,218 is to replace 4 ambulances. This will be purchasing 2 new complete vehicles, which will get us 100% compliance with the safety standards we've been talking about for the last few years. And we will be remounting 2 of our existing trucks, which is the first 2 trucks we purchased back in the 2014-2015 range that met the standards. We will be remounting those, which is a significant cost savings of just $60,000 to $70,000 per unit. With the remount, the infrastructure of the vehicle, of the module, the ambulance module will stay the same. It will have a brand new Chevrolet chassis put under it, and all of the wear items in the ambulance module will be replaced and updated, be it the upholstery, be it the electrical wiring, be it the fans for the heating and AC and that kind of stuff. So since we are now 100% compliant for the next few years, we will be able to do remounts, which will be a significant benefit to us as far as cost. These will be purchased factory direct from Demers, which is a practice we've been doing for the last few years, and will be purchased through the SAVIC purchasing group, or SAVIC purchasing coalition, which is really beneficial to the county as far as not having to go out for bids utilizing the SAVIC group. And that is the same practice we've done truthfully since I've been involved in ambulance purchasing. So that is nothing new. So we come before you for the $502,218 to replace the 4 ambulances in FY21.
Thank you, sir. Any questions for Mr. Lentz?
Jimmy, can you talk real quick? You know, we most of our vehicles, we go by mileage. You guys are a little different in the ambulances. It's mileage and then also the hours that the engine or the motor is running. Can you talk a little bit about that?
Sure, absolutely. And I wasn't sure how much to abbreviate it with the virtual meeting and wanted to be respectful. I know we do typically provide that information, and it is on the justification we turned in. But the 4 units we are proposing to replace all exceed the 100,000 mile fleet policy of Cabarrus County with actual odometer readings. But as we have done recently at the manufacturer's request, the GM's request, is to multiply each actual engine hour by 33 miles. So when we do that, as you can see in the document that was submitted, that puts us in the 260, closer to 200,000 in some cases on these, up to 275,000 as far as the realistic mileage that's on them. Because we spend so much time on scenes or whatever to where the vehicles are running. So everything in the vehicle is still getting wear, just the tires aren't actually turning while we're on scenes and while it's parked running. So that is the fleet manager, Mr. Farr, Mr. Billifer, and us agree that is a much more true view of the actual wear on the trucks is the engine hours.
Thanks.
Any other questions or comments? I think Jimmy, is that about what we've been doing 4 a year? Is that pretty much standard recently?
That is got to be a good number that is working well for us. It is exactly what we did last year. However, the last year's purchase was 4 new ones. So we are coming in slightly less than last year, being that we're now able to remount the 2 existing trucks we've got. That was a factor in going with Demers when we switched over to them in 2014, because if they do the remounts, they will continue their manufacturer warranty. And they actually will do it more than 2 remounts. I have concerns with remounting a box as far as metal fatigue and other things that go along with that. You know, doing more than 2 remounts per box, but I feel very comfortable with remounting the box one time, which is where we're at now, and we will be 100% Demers as our manufacturer. All of our 18 vehicles will be Demers, which is a huge benefit to us as far as service and the garage not having to be familiar with multiple different manufacturers, and all of them will be the same bumper to bumper. It helps with our crews being familiar with where cabinetry is and where things are placed on the vehicles when all 18 are the same. So this is an accomplishment we're very proud of, and look forward to continuing to do business with Demers.
Thank you. Okay, any other questions? Thank you very much. We move now to item 4.11, implementation of the fiscal year 21 capital improvement plan accounting. And we are delighted to have Susan Fearington with us to talk about that.
Good afternoon. Yes, but back in June, when we passed our budget, we had an extensive list of different capital projects that we wanted to start in FY21. So this is a matter of getting the accounting in the proper place, the proper funds, making transfers from all different sources of revenue to be able to fund over $12 million worth of capital projects that we will encounter this coming year. You have a list included in your agenda packet. I did want to point out that one item, which is the 6th one down, it says the Northeast Cabarrus Radio Tower. That one will not need to be funded. It was funded in a prior year, and we will take that one off the list. So when by the time that you have your regular meeting, the budget amendment will not include the $160,000 for the Northeast Cabarrus Radio Tower. We have already some money set aside for a radio tower, and it's the same one. So we want to don't want to fund something that we don't need to. So based on the project, we have funding coming from the capital reserve and some general fund monies to be able to fund the 12.6. And some of the larger projects, we will definitely come back to you and give some updates. And of course, anytime you want to hear updates on any of these projects, just let me know. But the projects sort of like the West Cabarrus Library and the EMS headquarters, we will definitely be coming back and giving updates on those projects as time allows the next couple of months. So by the time you get your agenda packet, you will have a huge budget amendment in there and several project ordinances to make this all work in our accounting system.
Okay, questions for Susan? All right, thank you very much. That is a big list. Okay, we move now to item 4.12. Also from Finance, update of capital projects, funding for Franklin Park Barn insurance proceeds. And we have Susan and Kyle Billiford to talk about that.
Yes, so back a couple months ago, we had some insurance proceeds that we received for the barn, and the amount so far of $145,208. We immediately needed to replace some of the supplies that were in the barn, so we have used $14,207. That was to get things ready for summer camps and things that we just had to replace right away. So those funds were expended before June 30th, and we have $131,001 that we need to get over into a multi-year fund so we can use that for the deciding what we're going to do with the barn. So that those monies will be set aside in a multi-year fund, and so we can be ready to track those expenditures in the future. Are there questions?
Now that was just an initial partial payment from the insurance company. Is that correct?
That is correct.
Right, and so the total amount that we expect to receive on the insurance of the barn was what?
Undetermined yet. I'm working with the insurance carrier. They're having some issues getting an exact value on the silo. We have exhausted our resources between Texas, Kansas, and California trying to find a silo builder who can give us an idea on that, since you don't see a lot of silos that are in that good of condition. So they're having some issues. I'm pushing them, but I'm also wanting to make sure we get the correct value on that silo so we don't get undercut. In terms of what my estimate is, I estimate between $0.7 and $1.9 million.
Thank you.
Yes, sir.
Okay, any other questions for Kyle or Susan? Okay, we move now to item 4.13 from Human Resources. Personnel Ordinance and Benefits Guide updates. We're happy to have Lundy Covington with us.
Good afternoon, Commissioners. I do have 2 items for you this afternoon. I'm going to start with the Personnel Ordinance. And with that one, on June 15th, the U.S. Supreme Court, in I believe it was a 6-3 decision, ruled that discrimination on the basis of an employee's either being gay or transgender is a violation of Title VII of the Civil Rights Act. So that has long been the EEOC's interpretation, as well as that of many employers, including Cabarrus County. But at this point, since that is now a formerly protected class, we need to add that language into our personnel ordinance to reflect that. So if you, Lauren, can maybe show them the ordinance language. There's 2 or 3 sections where we've gone in and actually added that behind the definition of sex, just to give a little further clarification. In addition to that, we took this opportunity to add some anti-bullying language. That'll be on the next page, Lauren. And with these changes, when we make changes to the ordinance, what it will do is also update our workplace harassment policy. So basically, I'm suggesting these changes to both documents. We did share this with our county attorney. He reviewed and approved this language. And I would also add that this is consistent with the desires of our new Diversity, Equity, and Inclusion Committee. So I'll stop at this point and see if you have any questions on these proposed changes.
Questions for Lundy? Okay.
Okay. The second item is in our employee benefits guide, and this is also a very brief update. We have language in there right now, and this relates to our health reimbursement account, where in certain situations we will allow employees to have another option if they're unable to establish that type of an HSA account that the majority of our employees have. We would like to expand that language. Right now it states that employees who are enrolled in a high deductible plan and have TRICARE, Medicaid, or VA benefits, but we would like to also now include other extenuating circumstances that could be approved by the county manager. An example of that might be somebody who is unable to open a credit union account because of credit issues or a debt obligation. So it would just allow us to give them an option the same as those other situations. So that's the second item I'm proposing for your review. Any questions on that one that I can answer?
Okay, questions for Lundy? I think they're both pretty self-explanatory. Thank you.
Thank you.
Okay. And if there are no additional questions, we will move now to item 4.14 from Infrastructure and Asset Management, Emergency Medical Services Headquarters Design Contract. And we have down Jonathan and Kyle on that one. Not sure who goes first.
Good evening. Cabarrus County staff has received 7 submissions from architectural firms for the design services for the new Emergency Medical Services Headquarters. They were due on April 24th of 2020. The selection committee selected ADW architects for the project. The selection committee was made up of Jonathan Marshall, myself, some infrastructure and asset management and ITS staff, as well as EMS staff. County staff has worked with ADWs over the past 45 days to define the services required and draft a contract for proposed services. County staff would like permission to enter a contract with ADW architects. The contract amount is a lump sum fee of $1,125,300 with an additional $62,000 in estimated additional services and reimbursable expenses. This is a standard AIA contract, and I've already had our attorney review that contract. I'm requesting that the board suspend the rules of procedure and approve the contract between Cabarrus County and ADW Architects and authorize the county manager to execute the contract on behalf of Cabarrus County, subject to review or revisions by the county attorney.
Okay, questions for Kyle?
Kyle, where is this building going to be built?
As discussed in the previous meetings, we're building that building at the site of Fairgrounds, which currently has an address of 789 Cabarrus Avenue, but I suspect that that will change once we go through the 911 process based on where the entrance drive will end up being. This contract, in terms of the amount, does fall into the certain percentage you would see in design in terms of the 7 to 9% of the total estimated cost of schematic design of that building. We're looking at a 30,000 square foot building, and that represents phase 1 of the EMS headquarters. Obviously, phase 2 would be built onto it in the future, and that would facilitate EMS going to more of a kind of a dynamic system like some other larger municipalities and counties have gone to, where all of the actual ambulances are parked in one location, and we kind of get away from a lot of these smaller stations. We're all administrating out of a central station, but we're not there in terms of the system yet, but that's the process for how we're building the building. So phase 1 will be built with the idea in mind that phase 2 will be attached to it.
Kyle, when is the anticipated opening date of the new EMS headquarters? You know I'm gonna ask that.
Yeah.
The viewing audience wants to know.
Yes, sir. I can only get to the breaking ground part so far. I think you would see breaking ground probably in September, October of 2021. And I would not have a construction schedule yet. I would imagine we're looking at a 12 to 16 month construction schedule, but there is an awful lot of rock in the ground at that site. So I would prefer not to be held to that. And without having a construction manager at risk under contract, I really wouldn't feel comfortable giving that date just yet.
I understand. So basically what you're saying is 2023, late, early 2024. You're not committing.
I would think we could actually make 2022, to be honest with you.
Oh, well, okay. Well, that's better. Thank you.
Yep.
He's writing that down, so you need
I'm sure he is. Sure he is.
Okay, any other questions for Kyle? Okay, at this time, I would entertain a motion to suspend the rules of procedure so that we can take action on this item tonight.
So moved.
Second.
Okay, have a motion by Commissioner Kiger, a second by Commissioner Honeycutt to suspend the rules. Is there any discussion? All in favor, please say aye.
Aye.
All opposed, no. That motion passes. And I would further entertain a motion to approve the contract between Cabarrus County and ADW Architects and authorize the county manager to execute the contract on behalf of Cabarrus County, subject to review or revisions by the county attorney.
So moved.
Second.
Okay, we have a motion by Commissioner Poole, a second by Commissioner Shue. Is there any discussion? Hearing none. All in favor, please say aye.
Aye.
All opposed, no. That motion passes. Thank you. Okay, we move now to item 4.15, also from Infrastructure and Asset Management. Infrastructure and Asset Management Operations Center renovations bid award, and we turn it back over to Kyle.
This presentation is being made for the Infrastructure and Asset Management Operations Center, which is located at 484 West Cabarrus Avenue. So that's the property that the county purchased, and these are the actual proposed renovations. These renovations specifically deal with moving fleet maintenance from their current location, which is also off of General Services Drive, down off of 49 in Concord, over to that location to give them a larger space. And predominantly it's so that they can have more larger lifts, which are the lifts that we use to get the ambulances up in the air. Our current fleet maintenance only has one of those lifts, so it makes it very difficult with EMS's growing fleet to get them in there. Sealed bids were solicited for the Infrastructure and Asset Management Operations Center renovations project, and they were received on June 18th, 2020 by a virtual bid opening. Staff and the contracted design architectural firm have reviewed the bids and has a bid award recommendation. The winning bid is within the capital funding that is currently in place. At the time that this agenda item was put in, I did not have the bids. We did have 9 bidders, and the winning bid was from LaFave's Construction Company. From LaFave's Construction Company out of China Grove. The total bid was $200,591, and that is including all of the alternates. And just for the board's reference, since I know there's been a lot of construction talk tonight, out of those 9 bidders, there was a range of $500,000 in between the lowest and the highest. However, the top 4 finalists, there was only a $15,000 spread. So that gives you an idea of the climate for that. Now, mind you, this project is a renovations project, so you're not looking at a lot of concrete or structural steel. However, that does kind of give you an idea of the tightness in the market in terms of the renovations market, which was very good for us in this instance. I'm asking the board to suspend the rules of procedure in order to take action due to time constraints. We'd like to motion to approve the bid award and authorize the county manager to execute the contract between Cabarrus County and LaFave's Construction, subject to revision by the county attorney. We will be using a standard AIA form that's being provided by our architect, Mooresburg. I have already reviewed the contract. It is standard, and I will send it to the attorney for his review also. And I can answer any questions about what the renovations pertain, what the alternates were, or anything that the board would like to ask.
Questions for Kyle? Kyle, is that facility turning out to supply all the needs that we anticipated that we would fill with that? I know that included some warehousing for both the county and the school system, as well as this fleet maintenance. How is the overall plan coming together?
It's housing the warehousing spacing and will house fleet maintenance, and will be able to move the actual infrastructure and asset management, administration, and building maintenance over there, including our sign shop, which means we can vacate the building at 242 General Services Drive, which is the green and white building below the animal shelter. We'll vacate that with the plans to sell that to the city, as they already own the property that this building sits on. It's on a grounds lease. In terms of warehousing, the space of filling all the needs for the county and the schools has been restricted. We have been able to provide the schools some warehousing ability, but it won't solve the future of all of the warehouse needs for the schools and the county. There's just too much between we house for emergency management, soil and water, co-op, the active living and parks department, all of the furniture for the entire county that is being surplus, plus right now what a bulk of that is being taken up as is all of the furniture that is coming out of the courthouse annex and eventually the courthouse when we go to renovate it and move into the new building will have to be stored at that warehouse. That's an large amount of furniture. We haven't gotten to this process in our courthouse for me to give you an update, but we'll be reusing a significant amount of furniture from the existing courthouse in the new building. And when I say that, it won't all go in the brand new building, but it'll go back into the renovated 1975 courthouse. I'm trying not to make that confusing, but we're using a lot of that furniture. So I've got to store that for a good 2.5 years. So that makes it hard to open up a lot of warehousing space for the school systems. There's also a lot of the layouts of that current warehouse for all the individual users that we have, it's difficult to create those pods or fenced-in areas while allowing a forklift to get in and out of all of them. But yes, what we actually, I don't know if Mr. Cohen is still on the line, but we've housed some things in our different warehouses for them for the new high school.
And that also includes property where we plan for a future facility for emergency management equipment that we had talked about previously over on 49 a number of years ago.
Yes, sir. We had looked at putting that behind the EMS station on 49, EMS 2. And we do feel that that parcel right across the street, across from Ramden Court, will be able to house that. And I believe that the current terminology we're using for that is the emergency equipment warehouse. And there is a CIP in place for those funds to come available. Actually, the funds will become available for planning that in the next year. And we'll start to dive into that. We already have the programming done, so it'll be going into the design. That site will have some stormwater issues that we'll have to handle, as would any site that we build it on, but we will start looking at that. And to further complicate that issue is that will house for emergency management, the sheriff's department, and EMS. And eventually, down the line, when phase 2 of the EMS headquarters is built out, which we just discussed, we would move that equipment out of that emergency equipment warehouse into that phase 2 and create more growth for the sheriff's department and emergency management. So it's kind of like a plan behind a plan behind a plan to be able to kind of facilitate this long-term need. It seems every year goes by, we get a different type of trailer or a different type of piece of equipment to be able to meet the needs of public safety.
Well, it's very, very much like we frequently talk about the needs of our school system. Our population continues to grow rapidly, and so hats off to you guys for looking out into the future and anticipating those things as they come along. Any other questions for Mr. Billifer? Okay, hearing none, then I would entertain a motion to suspend the rules of procedure in order to take action due to time constraints on this issue.
So moved.
Second.
Okay, we have a motion by Commissioner Honeycutt, a second by Commissioner Shue to suspend the rules of procedure. Any discussion? All in favor, please say aye.
Aye.
All opposed, no. That motion passes, and I would entertain a motion to approve the bid award and authorize the county manager to execute the contract between Cabarrus County and the awarded contractor, which I think you said was LaFave Construction, subject to revision by the county attorney.
So moved.
I'll move for approval, Mr. Chairman.
Okay, we have a motion by Commissioner Kiger and a second by Commissioner Honeycutt. Is there any discussion? We have a little bit of a time delay going on in some of our voting there, so I'll slow down just a little bit. But hearing no further discussion, all in favor, please say aye.
Aye.
All opposed, no. That motion passes unanimously. Thank you.
Thank you.
And while we're still with infrastructure and asset management, we move to item 4.16, recommended approval of preferred alternates for courthouse expansion project, and back to Kyle.
Well, thank you for having me again on this item. This will not need to suspend any type of rules, so this will go to the regular board meeting. North Carolina General Statute 133-3 requires performance standards to be used when specifying products. The statute also allows preferred brands of equipment to be bid as an alternate on the Cabarrus County Courthouse expansion project, provided that the performance standards were approved by the Cabarrus County Board of Commissioners. To be approved, the alternate must either provide a cost savings or maintain/improve the functioning of a process or system affected by the brand alternate. Approval is requested for the preferred brand alternates for the equipment as indicated on the attachment. I wanted to give you a little bit of background on this. We knew this was going to happen early in the construction manager project. This is different than a lot of the single prime bidding that we do. In a single prime bid, we bid just regular alternates, like the agenda item I just had before. I told you that we're accepting all of the alternates. Well, 2 of those were for preferred brands. That means those are brands that we use in other buildings. We have a stock of, we use the exact model number. Our people are familiar with them. We have a local vendor in them. It could be any of those number of reasons. But when you get to a large project like this and you bid this out through the guaranteed maximum pricing, you need to be very specific and make sure that your board approves this prior to. And I wanted to give you a couple examples because I did go out and do some research on this. And after checking with the Mecklenburg schools, I believe they had 28 preferred alternates. And it ranged from water heaters to chillers, all the way down to what type of hose spigot they would use. And I'm sure that creates some ill feelings towards certain vendors and manufacturers in the area. The design team, made up of myself, infrastructure and asset management, Silling Architects, and Messer Construction, worked very hard to get the list down as low as possible, meaning we hunted for absolute alternates that could work with the type of material we were looking for. For example, we had showed you guys a kind of a synthetic wood paneling that would go on part of the courthouse. We scoured the entire country to make sure that there was going to be healthy competition in that, so that we wouldn't give a preferred alternate to somebody that could basically raise up the cost because we had called it a preferred alternate. So we've whittled this list down to 3 different categories, and they're on the attachment that's provided, as well as the attachment that goes to the general statute. When we first began the list, it was nine different items or categories long, and then we whittled it down to 6, and then we were able to whittle it down to 3. And those 3 sections are dealing with building automation systems for the HVAC. It's listed as DVC controls, but that's basically how we control the HVAC, the actual smart system behind it. And we're wanting to stay consistent with what we're doing in our larger buildings now. Another section is interior lighting, and that basically revolves around trying to make sure that these are going to be tunable light fixtures, meaning dialing into the same type of light, whether it's warm, whether it's cold. We want to stay with one manufacturer so that on one level or in one lobby, the light fixture has the same tunable amount as another library. So another area. So as you're walking through, it's not a different range of white, if that makes sense to you. And then the last area was exterior lighting. We had a lot of difficulty trying to find type of plaza lighting that would offer the different functions that we wanted out there. So those were the 3 areas that we whittled it down, and I will answer any questions about these, but I did want to let you know that we've been working on this for about 3 months. And after reviewing some other counties and school systems list, I feel that we have done a really good job at whittling this list down, which means it's more of an open bid process.
Okay, questions for Kyle on this item? Okay, thank you very much. We will move now to item 4.17 from Tax Administration, Tax Collector's Annual Settlement and Order Authorizing Collection of Fiscal Year 2021 Taxes. And we are glad to have David Thrift with us.
Good evening, Commissioners. So, North Carolina General Statute 105-373 calls for the annual settlement of the tax collector. I have prepared a list of delinquent 2019 taxes for real property accounts, so that's real estate, as well as a list of 2019 delinquent taxes on personal property. Those two lists will be available for review in the county manager's office. What I've provided you in your agenda packet is a summary of those outstanding balances, and those are broken down by jurisdiction. Also, per General Statute 105-373, I have prepared a list of tax bills on personal property that we have deemed to be uncollectible. Every effort to do so has been exhausted on those, and I'm requesting that these taxes be placed on the insolvents list. The other piece then is the North Carolina General Statute 105-321, which provides for the order to collect next year's tax receipts. I've provided the projected levy for the fiscal year 21 on the real and personal property taxes for you. So I'd ask that you accept the tax collector's settlement as provided, and also move to approve the order to collect in accordance with 105-321. Thank you, and happy to answer any questions you may have.
Questions for Mr. Thrift? Okay, thank you very much. This will be included on our regular agenda, or on our consent agenda, I think. And so we move now to the approval of our regular meeting agenda, which you all have a copy before you. As I mentioned earlier, it does include the one public hearing that has been called for tonight. Do I hear any other adjustments or corrections that need to be made to the regular meeting agenda? Okay, hearing none, I would entertain a motion that we approve the regular meeting agenda as presented.
So moved.
Second.
Okay, we have a motion by Commissioner Honeycutt, a second by Commissioner Shue to approve the regular meeting agenda, including a scheduling of the necessary public hearing. Any discussion? All in favor, please say aye.
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 All opposed, no. That motion passes unanimously. We do need a closed session tonight. So at this time, I would entertain a motion to go into closed session to discuss pending litigation, economic development, and acquisition of real property authorized by North Carolina General Statute 143-318.11 A3, 4, and 5.
So moved.
Second.
Okay, we have a motion by Commissioner Honeycutt, a second by Commissioner Kiger to go into closed session. Is there any discussion? All in favor, please say aye.
Aye.
All opposed, no. That motion passes. We thank all of you and our television audience for joining us tonight. We will now be in closed session. For members participating, you will need to close this Teams meeting, and I think you all will have received an invitation for an additional one to reopen. So we'll see you in the next window. Thank you. We'll see you in the next window. Thank you.